Okay, so hi everyone. Today we'll be holding a little webinar based on the recent series of events surrounding COVID-19, coronavirus, and how it's been hitting all of our countries. So before we move forward, could we have everyone one by one just say their name and which country they're from? Saad, could we start with you?
Okay, my name is Saad Ihsan, and I'll be trying to give Kazakhstan's perspective on this.
Okay, my name is Shravnee. I'll be representing India.
Hello, my name is Pyenjo and I will be representing Bhutan.
And I am Prottoy, and I'll be representing Bangladesh.
And I'm Ammar, and I'll be trying to host and moderate you guys and fix any problems if we have them. So, okay, so we'll start to the first, the very a very basic overview of how coronavirus and how COVID-19's been hitting our country. So maybe starting from Thinley, how do you feel? What's the current status in Bhutan? How did it enter, and what's the current number of cases? So yeah.
Thank you so much for Mahatma for giving a first opportunity to me to explain and express and to tell all my friends about how our country is handling the situation. First of all, till date there's only 2 cases of coronavirus, and both cases with the foreigners, the tourists who have visited our country after April 5th. The first case was found on the April 5th, and as soon as the case was confirmed, and the three districts from in our country are all the institutes, schools are closed. But after 14 days, the quarantine period, then there's another case, a second case, and the the Prime Minister Office issues a letter saying that the whole country should, the institute and other necessary things should be banned. I mean, stopped in order to ensure there's no further spread of coronavirus. I should say that we are till date. There's no one pure goodness. I should say there's no single goodness has been affected by coronavirus, and our government is doing great, and our king, along with the prime ministers, are working so hard that to fulfill that single miss shouldn't be die out of this pandemic disease. So thank
Okay,
you.
so there's only 2 cases in Bhutan. Is that right?
Yeah, thank you.
Okay, so I think that's a very interesting perspective. Let's move to maybe let's get India's perspective. Shravani, what's the situation like in your country?
So there are total 591 cases, which is quite a big number, and 30 new cases have been reported like just today morning. And in my Mumbai, I live in Mumbai. It's a metropolitan city, and in Mumbai, the impact is quite severe. And people are trying to take steps, take initiatives, and actually, we are under a complete wide lockdown. And a majority of people are taking precautions, but there is still 10% of the population of people which are not following the laws.
Okay, so let's see how things are like in Bangladesh before we move to Saad, who will tell us a little bit about Pakistan. So, Prottoy, how's things going in Bangladesh?
Well, actually, what I have seen from the news and other medias that in total Bangladesh is facing like 39 total cases right now, of which 5 have been confirmed dead. But actually, what's in the air is that the cases are even more than this. Like, I already know 2 or 3 people who have been dead already by coronavirus, but at that time, when I got to know that 3 or 4 people were dead, the news portrayed only 1 or 2. Yeah, so I think many are still unregistered, and even today, 2 more people have died from the coronavirus. And Bangladesh being a very densely populated country, the city where I live in, Dhaka, it is actually recorded the most densely populated city in South Asia, and also the city having the most bad weather, bad pollution use, which I'd like to say, record for the most, like, the worst pollution in South of Asia. I think we are in a risk of being affected by coronavirus and other things in a very dangerous perspective. Yeah. So yeah, that's all for today right now.
Okay, so let's move to Saad. Saad, what do you think? How's things like in Pakistan?
Okay, so with Pakistan, the way it's been treated, we've seen a very exponential growth, not only with the virus, but the way it's been treated over there as well. So, just a few weeks ago, the virus wasn't being taken seriously at all. And that was seen completely within the way the public was reacting and also our leaders as well. But lately, seeing as how there has been a very vast surge in the number of reported cases, and that's not even to say the number of people who have actually been checked, and the actual number of cases are probably much more than that, seeing as how we just hit the thousand landmark. It's pretty scary to see just how badly we were taking this beforehand, and now we're seeing that it's suddenly being taken a lot more seriously. In some provinces there has been some sort of pseudo lockdown, with the most serious there being in Sindh, where where there has been a curfew implemented, and the army has implemented the lockdown over there and is very forcefully enforcing it. And looking at how suddenly, due to this rise, like the way the Pakistani people responded to this has been very uh, like it hasn't really reflected. It really reflects the way we they perceive very big problems as because as soon as this virus came in and people started to realize how dangerous it was, there was a there was nationwide confusion, and people are still aren't able to grasp how important it is to practice social distancing and things like that.
Okay, so since we're talking about people, if we talk about the people of, let's move on to the public response in India, for example. So, Shravani, how do you think feel like, since I think after in the conference of people sitting here, after Pakistan, India has perhaps the most number of cases out of the 5 people we sitting here. So, how do you feel like people have responded? What's some good things they've done? What's some bad things? What's the general view? How does the normal Indian think of coronavirus to be?
Okay, as I said earlier, our Prime Minister has announced a 21-day nationwide lockdown. So people are accepting the idea of nationwide lockdown very well, and we are still, spreading awareness through social medias, uh, and there are several steps also taken by the government to spread awareness. Media is doing their job very well, and government has also funded a research institution to search for vaccines, as it's very important. And that's
Okay, and how about let's talk about Bhutan. So, Thinley, there's only been 2 cases registered, but there's a big closure of institutions, lockdowns as well. So, how are the people reacting to that? What's the public feelings look like?
Thank you, Mahatma. First of all, as soon as we heard about the first cases, our government have already planned about how to handle this case, as being our Currently, our elected prime minister is a expert surgeon. So due to our like, it's our blessing in the disguise to have such a prime minister as our head of the government, and he have already planned everything. But as soon as the government heard about that cases, the government had issued hand sanitizer to all the peoples of our country, and then in case of public response, now all the hotels, resorts have answered that they have they have agreed with the government that they will give their resorts for a quarantine state and make it into a quarantine state where gives everything uh, to which will give very good facilities to our continents. And very good thing about our country current situation is that all the students, people who are working abroad have came here, and all people should go undergo a quarantine state, quarantine. I mean, and they are provided. The government is paying 100 per head per day for their quarantine period. And being a Bhutan, being a very small country, a sandwich between two big countries, having a great fear that if it happened to affect our country, it will be a great loss for us. And but we are preparing for that. Thank you.
Okay, I think that's a great perspective, and seeing how the public is volunteering to give to give different hotels as well for quarantining. But how's the situation looking like in Bangladesh, Prottoy? What's the people feeling?
Well, actually, from my perspective, from where I see it, many people are still unaware of the severity of coronavirus. For example, a few days ago, when actually the virus wasn't that much severe as it is right now, some journalists, they interviewed the common people in Bangladesh who were still involved in mass gatherings, like in fields playing cricket or like in mosques. The response from the people was like, the coronavirus doesn't affect Muslims. We do this, we do that, and Bangladeshi people's culture is that they're going to hug and come into physical contact to express their love for one another, etc., etc., which actually proved how unaware people are right now. And also, even in this situation, when the government has uh, like has throughout the country declared 10 days of precautious lockdown from 26th of March till 4th March, the people are still going out on dates and then going to public gatherings, attending Jummas in the mosques, and all. And still people are still unaware of it. And the most important thing is that
I think the video's paused.
I think there might have been a internet problem.
Okay, there might have been some technical issue, but while we wait for him to reconnect, we can move on to Saad. Saad, what do you feel like with reference to especially the things Prottoy was discussing too, in terms of the some sort of a religious hysteria which is enabling the spread of the coronavirus? How, since Pakistan is also a Muslim country, how do you think how rampant has that been in Pakistan?
Okay, so one thing that I feel has been very prominent in the way that Pakistan has dealt with the virus, being a Muslim country, is that they've tried to leave a lot of things in the hands of God, as they say. But but because of that, they are putting other people in danger. We see these within a lot, within how religious meetings, how the Jummah prayers, how congregations are still carried out, even though people know that this might lead to the death of other people. And it's this unawareness that is ultimately going to get this a lot more, make this virus a lot more serious than it needs to be. And it would lead to a lot more deaths in our economy, where we can't hope to tackle such a severe problem. And besides that, we've seen that, like, is there an example of the religious the way the religious leaders have been reacting to this is that I remember that there was this one leader who said that if we're all going to meet in a religious gathering, and if I get coronavirus, then then you could hang me. And it is that exact mentality that has led to this situation being picked up much later than it needed to. And now we're in a stage where we're trying to reduce the amount of extreme fatality, the extremeness of the situation, rather than trying to control it. So we're pretty much too far off the edge, but we have to try our best to try and not fall too below.
Okay, I think that's a great perspective on the matter as well. We're being joined by Vivian Chen, who's a student in Taiwan. I hope she can get her audio in.
Yes.
Yeah, so Vivian, we were just having a general conversation about how coronavirus has been hitting our countries. So, could you
Yeah.
give Taiwan's perspective on this matter? How rampant has coronavirus been in your country? What's the current situation looking like?
Also, our current situation is around 200 people being diagnosed with coronavirus, and I believe that the government has done a safety precaution really fast before the thing that happened because of our history of the SARS. Because during the 2002, the SARS outbreak has killed almost one third of the Taiwan's population. So, just before in 2009 December, just before the coronavirus went worldwide, Taiwan has already been in the safety precaution. So I think that despite the population of the diagnosis is getting up to that 200 something, I still believe that it is under control by the government, and we hope that the government will continually take precaution of this coronavirus. Yeah.
Okay, so we were also discussing about how the public, how the general people in our countries have been responding to the threat of COVID-19. So, what do you feel? How, being someone who's living in Taiwan, how do you look at the people in Taiwan reacting to the threat of the coronavirus? How seriously are people taking this threat?
Actually, I think that people in Taiwan they know that it's really important to wear masks and do all the safety precautions, but people are still wandering around in the streets, and I think that it's quite dangerous because, for example, in NTU, because I'm staying in NTU, in our campus, we have restrictions that no are allowed to come in during this precaution period. But during the weekends, people will still come in and visit our campus. So I think that it is something that people and the citizens and the students in Taiwan should be highly aware of this issue, and to support the government as well to reach a successful trying to take the precautions more seriously. Yeah.
Yeah. So, and Vivian, another discussion we were having was about how censorships have played a role. So we had Prottoy in here from Bangladesh's audio just dropped, and he'll be back in a minute, I think. But he was talking about
Okay.
how Bangladesh has reported only about 30 to 40 cases, but the word amongst the citizens is that inside the hospitals, the real on-ground situation is that there's actually a whole lot of cases. So, what do you feel? Is there
Yeah.
any disparity like that in Taiwan as well?
I believe that there is not that kind of issue because the government has been quite um they didn't hide any issues, and also they always have all kinds of conference and live conference for Taiwanese people and Taiwanese people to ask their authorities about how the conditions are. So I believe that there is not a problem in Taiwan. Yeah.
Okay, and Shravnee, what do you feel like? How are things like in India? Because a lot of people are saying that India, it's one of the biggest, it's the biggest democracy in the world, perhaps, and more than a billion people there. And so there's a very popular general sentiment that's prevailing that perhaps it might not actually be the case that there's only 5 or 600 people, even though that's still a very large number. What do you feel about this?
Actually, according to the government, the cases reported are accurate. The number is accurate, but I think there might be some people in rural areas, especially, who are like actually scared to report. They are not quite aware of what's happening in the country, and what is the virus, how it affects different people, and how it spreads. So I think there are few cases unreported, but government is trying their best to report every case and submit the information to World Health Organization.
Okay, that's great. And so before we move to the government, since we are still on the topic of society, one very popular opinion which has been, and I'd rather say a very popular fact which has been floating around, is how in this time of this global pandemic and this time of uncertainty, the certain prices have gone really, really up in a lot of countries. So especially the prices for masks as well as for hand sanitizers. So let's have a general comparison of how all of us in Asia are doing. So, Prottoy, can you hear us now?
Yeah. I can hear you and I can see you.
Yeah, so starting from Prottoy, let's try and sketch out what are the prices of a sanitizer and a masks in our country, just to sort of compare the economic situation and how the countries are.
Well, from a Bangladeshi perspective, the country, I don't think Bangladesh is suffering from lack of availability of sanitizers or masks. For example, I can like go into the nearest pharmacy near my house and I can find like 4 or 5 masks available for a family, which is like reserved. So I think the government is doing a very good job in managing this for pharmacies and some NGOs as well. And yes, the government is also providing funds to some public and private universities for making hand sanitizers from low cost as well, and it making sanitizers and area people as well. So yeah, I don't think that's an issue in Bangladesh.
Okay, and if we move to Taiwan, for example, Vivian, how's the healthcare situation looking like?
Same with Bangladesh as well. In Taiwan, hasn't been that kind of issue of the prices going up or the inflation, because in according to the Taiwan government, they came up with a policy that you can collect um, masks according to your ID, and just bring the ID into the pharmacy, and they will just give you masks. So although there has been a ban of masks going export, but then in the domestic people and domestic citizens inside, we don't have this kind of problem because we are still sufficient with all kinds of, for example, sanitizers and masks as well. So that is not an issue. It's not a serious issue in Taiwan. Yeah.
Thinley, we were talking to you about how Bhutan has reacted with reference to its healthcare situation. So, what's the situation looking like?
As soon as we heard about the first case in the country, there's some cases that there's a rise in the cause of masks and sanitizer in the pharmacy. But then, as soon as the people, the government heard of that, then the government had issued an order that they shouldn't be raising price, and now all the people are getting at a cheaper rate, and where they can afford it easily.
Okay, and Saad, finally talking about Pakistan, how do you feel like this healthcare situation has been tackled by Pakistan and the general public and the local pharmacies, even? Yeah.
Okay, so in Pakistan, when the issue was not being taken too seriously by the public, the medical practitioners and the pharmacies realized the amount of advantage that they could have by hiking up the prices, and so up they went. So from around, I remember in the early days, I was wanting to get some face surgical masks, and I think a box costed around 200 before, and it was firstly when we asked for it, it was they said it wasn't available, but we insisted, and then they said that the 200 one was going to be for 2000. So that's a 10
Whoa.
times increase. And looking at the way that that was done in the beginning, it was really sad to see the way it was being handled by these different pharmacies, and the way they were trying to exploit the such a bad situation. But recently the government did I believe the government did crack down on these. And but also there was a case in which the 20 million surgical masks were also smuggled out of the country, for which the health minister, I think he's currently being held accountable for that as well. So generally, with the way the people try to take advantage of the situation and of the common citizens, it was really disheartening to see that over here. But recently there have been a lot of improvements, especially with the amount of recognition that this whole situation is getting right now.
Okay, so just a little reference, 2000 Pakistani rupees equals to almost about 15 US dollars. So a box of masks for that much. And so I think, yeah, that's a pretty big hike, as Saad mentioned. But moving on to, as Saad was also talking about, the government. So obviously, governments at a local level as well as at a provincial and national level in all our countries have done something or are in the process of doing something to save citizens from the coronavirus threat. So, what do you feel? Let's start from Vivian. Uh, Vivian, what do you feel like? How effective has the Taiwanese government's response been to controlling the threat of COVID-19?
Just like I said, I believe that the Taiwanese government has done their precautions as the quickest. Just before 2009 December, they started screening their passengers during their flights and starting to take all the precautions. And I believe that they have been trying their very best to take all the safety precautions as well. And yeah, so I believe that the government has been constantly improving and constantly trying to help their citizens out of this epidemic. And yeah, that's what I
And
believe.
and so in Taiwan also right now there is a lockdown. Yes.
Yeah, and there isn't a lockdown, but there's a
Okay.
ban of international flights. There has not been a lockdown. Yeah.
Okay, so there's not been a lockdown, but there's been a
Yeah.
ban on international flights. Let's get to Bangladesh now. Prottoy, what's the situation looking like in Bangladesh? How's the government responded to it, and how effective do you think it has been?
Well, first of all, the government has declared a 10-day precautions lockdown from the 26th of March till the 4th of March. And besides that, the public exams for the higher secondary level, which was about to be held from the 1st of April, 26th March to 4th of April, the 10-day public lockdown. Uh, and the higher secondary exam, the board exams, it has been not postponed, but it's been stopped. Like they're going to get, uh, like, either they're going to get grades as expected by the schools from each and every single student, or they are going to like make another initiative as a substitute for that. As well as that, like from the 26th of March to the 4th of April as well, the government has also made initiatives for the army to be deployed in different rural areas to assist the civil administration, as well as public transports and financial services has also been limited in these days. Private and public sectors have all been shut down except for the emergency services that are like needed for people, for the general people, as well as multiple measures for low income groups has also been taken. For example, like in Bangladesh, small and cottage industries are a very huge sector for our export incomes. So in these sectors, the main workforce is actually the women. Okay, women are actually being the actual workforce of these sectors. The government has taken initiatives for them to be provided with stipends and uh, funds so that they can run their families as well, ensuring that rural people are not affected by this severe condition in Bangladesh, as well as that sending suspected people to quarantines and planning to distribute masks to the public has also been an initiative from the Bangladeshi government. Although the Bangladeshi government is struggling a little bit with statistics displaying to people, showing that the number of people isn't actually as much as it should be, even though we know it's far beyond the actual numbers. The government is still trying their level best to cope up with the situation.
Okay, so I'll jump directly to Saad before taking on Shravnee's opinion on this, because I feel like since I'm also in Pakistan, the situation described in Bangladesh with reference to the deployment of the army in certain situations, I feel like that draws a very close parallel to that to what's happening in Pakistan right now. So Saad, what do you feel like? How effective has the government's response to the situation been, and what's the current dilemma facing the Pakistani government?
Okay, so here in Pakistan, the main issue is the volatility of the public itself, and the government recognizes that. So you could say that the way they've been handling the statistics and the way that they've been actually conveying the situation to the public, it has been kind of like they've not been giving them the actual statistics, but actually in order to make them a bit less panic, in order to cause a lot less panic within the country, it's been made so they get a very sugary way of a very sugary description of the actual situation itself. And besides that, the way that the situation has been tackled, for example, one of the biggest the cases was rising from a camp in Taftan, which border a place which borders near Iran. So over there, a lot of new cases were recorded, and due to that, around, I think, 4,000 people were put in a quarantine camp over there. So, and the way it was being handled, the government was trying to tell the public that it was kind of in control, and the people that were over there were getting the necessary utilities and the supplies which they needed. But from the actual accounts of the people over there, we discovered that the situation is pretty much horrendous. The way the people having to live in very cramped spaces, not getting the supplies that they need, the medical checkups. A person they recounted that on the first day they were checked with a thermometer and nothing happened after that. So like it's things like these which were basically telling of how the government is responding to this. But also, one thing that the prime minister did say about our economy and our country in general was very right, because our country is not as stable as an economy as others. And due to that volatile nature and the way that the business is conducted over here, we couldn't really afford to afford a complete lockdown very early on. And because like in our home situations, only about 10% of the jobs that are here would be able to be done from home, while the rest of the people who make their day-to-day earnings right outside, they wouldn't be able to handle this. And so because of that, these measures were pretty delayed, and it was this delay that really caused this situation to rise out of control, which is currently
and
being.
and I think Prime Minister Khan also talked about this in his public addresses and in his press conferences as well, where he mentioned how there's a very unfortunate dilemma facing the Pakistanis, where they can either choose to die of hunger or to die of the coronavirus. Because if there is
Yeah.
not a complete lockdown, there's going to be a massive spread of the coronavirus, granted. But if there is a lockdown, the Prime Minister suspects that there is going to be a lot of underprivileged and poor families who will be facing facing food impoverishment and all these different issues that an underdeveloped country like us or a developing country like us with a not so stable economy would be facing. But moving on to neighboring India, Shravani, you talked previously also about how the Modi government has announced a lockdown. I feel like I think in India. So could you talk a bit more about how the government's been responding to this threat?
Okay, so it brings everything except essential services to a halt. And one, I would like to tell you guys about one initiative, one step which I personally thought was like important. So our government, our prime minister, he initiated Janta curfew. Okay, so where all the citizens of India were requested to come to their balconies at 5 p.m. on 23rd of March and clap 5 minutes for to appreciate the jobs and to express our gratitude towards the police, nurses, and doctors who are working all throughout the day during this pandemic. So I thought this was one of the best initiative taken. And besides that, government is still struggling to ensure a full participation for this lockdown, and that's basically it.
Okay, so I think from Bhutan side, we already got a pretty clear view of how the government has been quarantining people and banning foreign travel as well. But Thinley, I'd also want to hear you out on what you feel like are some important steps which the government can take in the future, maybe, or what you feel like are some steps which the government took and perhaps they weren't the best things to do at that time. Do you feel like perhaps with only 2 cases in the country, the Bhutanese government is maybe a little overreacting to the issue? How do you feel about it?
I think there's only 2 cases, but there's two cases. I think the 2 cases due to the number of cases are very low because it is mainly due to. I think this mainly because of the great work and effort that our prime minister along with king have put, and all the peoples are coming together and giving us supports in every aspect, in financial, in the in place of men force. Every that's maybe that's the biggest secret I think the our country is doing, and there's maybe a reason why people are not affecting much. And second thing, the good things about that, we being a Buddhist country, we have a belief that we believe that to this if we are so Buddhist and we are Buddhist minded, and we always pray and we share everything that, and we listen what our kings and what our the head of the state and religion tells us, and we follow them, and that's maybe a reason why we are not affected that much. And I hope the king, the prime minister, and the country and the peoples will work same pace that our country will be not affected further. Thank you.
Okay, so coming to Vivian, I think you heard the views of all of us, mostly South Asian countries, sitting over here, and you listened to how there's been lockdowns and or precautionary measures, as with the case of Bangladesh in a lot of countries, and you mentioned how there's not yet been a complete lockdown in Taiwan, but they've banned all foreign travelers. So, what do you feel like would be a reasonable course of action for the government to take in the future? What do you believe they can? Which example do you think they should be following from the rest of the world?
Of course, I believe that when the amount of people has been it will be rising, they should really lock down the places like other countries should be doing. And considering the economic, um, because of the economic, we have to sustain the economic for the people to live. I believe that they should also take this as a precaution for the lockdown. For example, they should, like India, they could give there some funds, and also to thank the people and the people in the nurses and the doctors, because in Taiwan they always get into a fight about who's doing the right thing, the government and the parties. I believe that they're really trying their best to sustain the environment and to not let the the numbers go up, but I believe that they should really help and support each other, and to give encouragements, and also give thanks to people that really has supported this whole entire thing. Yeah, that is what I believe.
All right, that's wonderful. Let's jump to Prottoy now. With reference to the Bengali government, there's been a lot of censorship going on. But then, with reference to perhaps how they could approach the healthcare or the economic situation of the country in the upcoming weeks, because there's perhaps bound to be a lot of volatility coming the whole world's way. So, Prottoy, what do you feel like? How effective has the government been, and what can we learn from each other, and what can we do in the future?
Well, I would like to say that there is no alternative to making mass awareness among the people in Bangladesh from the standpoint from where I see it, because many people, as I've already mentioned earlier, are still not aware of the severity of the case. Because yesterday's news in TV, which I found very funny, was that the expatriate workers which have come to Bangladesh, which actually stated about 3 lakh. Of one of them, a journalist came and interviewed one, and he's still roaming around his rural village and going to tea stalls and public places, and he's not even aware, he's not even caring about what effects other people might have because of him doing all of these. So he's actually quite negligent, and I believe that there are more than the expected amount of people we are expecting from like these uneducated, unaware expatriate workers which have come back to Bangladesh. So mass awareness is like a must, and also to prevent public gatherings from taking place, I think that the government should impose big fat fines on people who are roaming around the streets for no reason at all, still attending public gatherings as well. And of course, Bangladesh being a country filled with very emotionally driven people, especially because of religion, I think the religious leaders have a very important part to play in this, because like in the masjids, in the mosques, the imams and the sheikhs, most of them are still not aware of the severity of the case, because they are still encouraging people to come to the mosque and pray 5 times a day in Jamaat and even in the Jummahs as well. I think they are a bit wrong in this thing, because the severity of this case and its aftermaths are to be considered first. So I think the religious leaders have a very crucial role to play in this, both in educating themselves and making their families aware, and the public people as well. And also, people should be aware of the expenditures they do. I'm talking about the aware people, in these 10 days of lockups, one family head would most likely to go into the nearest supermarket and take all the buyings as well for surviving these 10 days. So I would like to give a message to them to not be gluttonous in the supermarket in consuming all of these goods, because you have to keep goods for others as well. So the government might also take in account this message and provide it to the other peoples to be aware as well. And the government should also, I think, inspire other NGOs and themselves as well to uphold posters and banners reflecting the symptoms and prevention measures for COVID-19, and also make available hotlines for instant COVID testing. Like many people, like for example me, I'm still not aware of how to contact the nearest hotline or the nearest station in my area to test whether I am COVID positive or not. So I think the government should take initiatives to make
Yeah.
the hotlines more available. Yeah.
Yeah, I think that's all of that's very important, and I think with reference to the public fines you were talking about, we have the example of Netherlands present in front of us, where there's almost greater than 200 euros fine to any person who's out in the streets without an essential reason. And with reference to the negligence as well, we'll move to Saad, who'll give a little bit of perspective on the Pakistani. On the way Pakistan can proceed to tackling this issue. But an interesting highlight, which I remembered once Prottoy was talking about people's negligence, was that recently there was a media outlet who claimed that the chief minister of Punjab, which is our largest province in Pakistan. So in a briefing with other health officials, the question was asked by the chief minister, and even though the Punjab government has sued the media outlet because they believe that it's fake news, but the outlet reported that the chief minister asked the question that how does the coronavirus bite? So because so I think that's very reminiscent of how there's been such negligence and such a lack of awareness in even our top hierarchy, that it needs to first start from there and then trickle down to the general public too. So Saad, closing remarks, what do you feel like, how can Pakistan learn from the examples present over here, and how should it be proceeding forward in your opinion?
So, with example, with Pakistan, it's very weird to try and consider other situations and the way other countries are handling this, because unlike other countries, there is a proper concern that is with completely locking down. So, it's like I completely agree with Prottoy. You said and the measures that he described, which completely are. Which really do apply to our situation as well, because as he said, imams and religious leaders play a very important role in emotionally driven countries like ours, and looking and seeing as how, if they are the ones who are able to convince the public, then they should be able to take the lead take the lead in fighting against this very important problem present within the present. And besides that, I think that yeah, a lot of the problem is within the social awareness and actually realizing how serious the situation is. Then, because social distancing in and of itself isn't the most hardest thing to do. It's just people not realizing how serious it is, that actually leads to that actually leads to this relatively weak disease spreading and resulting in much more casualties than needed than there should be.
Okay, so let's jump to Shravnee's views on this. Shravnee, what do you feel about it?
Even I agree with Prottoy about the initiatives that should be taken by the government. Moreover, as we are focusing on the precautions, we should also focus on the research. I believe that we are from different countries. The different countries can organize a research institution together. So for finding a vaccine or medicines, drugs, and I believe that different minds, if they come together, the process would be more efficient. And also, as you talked about fake news circulating through the social media, I believe government should create a community, a cyber community, who can keep check on these fake news, so that it is actually scaring people unnecessarily and spreading out false information. So that can be one of the measures.
That's, I think I would wholeheartedly agree with that, because in the past 1 or 2 weeks which I've been locked down, I've heard, last night I heard that coronavirus is actually CIA's largest intelligence operation, and before that I heard that it was perhaps a means of biological warfare against the Chinese or against the Americans, or and there's been all of these absurd conspiracy theories which have been floating around, but closing remarks. I think did we take Thinley's opinion on this?
Okay, thank you so much. Now it's a pandemic. It's a pandemic, and whole is suffering from this particular disease. And at such situation, whole world should be coming together and joining our hands to fight against this particular disease, because at last we all are suffering a lot. So therefore, and as a sincere prayer from our Bhutan on behalf of my king country people, soon that the people who have been affected will be recovering soon, and so those who are not affected, they will stay safe. And I always look forward to work with you, team.
Okay,
Thank you.
so do we have any questions from each other, from about each other's countries, or about anything related to COVID-19 or generally?
I would like to ask something to Miss Vivian. Miss Vivian, are you there?
Yes.
I would like to ask you, you mentioned that Taiwan isn't in a precautious lockdown right now. Am I right?
Yes.
Do you see any any government declaration coming in the near future from the coronavirus? Because it is a pandemic right now, which is actually threatening the entire people around the globe. So do you really think any precautious lockdown is coming in your country anytime soon?
I believe that the lockdown will be coming soon because the government has already told the public that reaching to a certain amount, they will lock down the whole city. And for example, for my NTU, for my university, they has already been banning classes that exceed 100 people above. So they're changing it into online classes. So I believe that as the um, as the pandemic, the population increases, they will lock down the city as well. So the government want to assure everyone um, be to be produced at to be yes. So I believe that they will be a lockdown in the future. Yeah.
Okay.
But fortunately, I believe and I wish that the whole city won't be a lockdown, and I believe that the citizens and the government should really do and play their part really importantly for them not to let the population rise. Yeah.
Okay. Do we have any other questions from anyone else?
Question. Because being a student, we are concerned about how we will pursue our education, and due to this pandemic disease, we all are the scholar coach in institute have been closed now. So thereby, how the teaching learning is taking place in each and every country. So I will be ready to hear.
Um,
Yeah, you can carry on.
Okay, so how the teaching learning is taking place in your country?
Yeah,
okay, I would.
let's start from
Am I?
Shravnee. Yeah, yeah.
Yeah, so we are attempting to take video lectures a lot in different schools, and also most of the exams have been postponed. For primary classes, most of the exams have been cancelled, but for senior secondaries, schools are giving assignments so that they can do the grading based on the assignments done to them.
Okay, and I think I'll be speaking on the behalf of Saad as well, since we both pursuing the International Baccalaureate
Yeah.
Diploma, that the May 2020 exams, which are scheduled to be held, we just received news about a day or two ago that they're not going to be held at all. And so, but since there's a lot of projects and internal assessments that we've already undertaken, along with the predicted and expected grades that we've been given, they'll be used to give us a cumulative, somewhat idea of how our future is going to look like, and then we're going to receive the diploma from there. But we could carry on to Vivian and Prottoy as well. Vivian, I think you're still in NTU right now.
Yeah, I'm still in NTU, so just like said, if the class exceed above 100, they would just change alter to an online class. And moreover, they're trying to ban people from going to schools as well. For example, like online classes, and also they're banning all kinds of extracurricular activities that is held in NTU in campus, and all kinds of activities are banned. So people are getting really, because some of my friends, they are feeling quite disappointed of this for this ban, but I believe that this is the right and the most correct way to deal with this pandemic. Yeah.
Okay, and closing remarks, Prottoy.
Well, from the education perspective of Bangladesh, I already mentioned that all schools and colleges, including universities, are all shut down till the 9th of April. First of all, the initial announcement that came was till the 25th of March from the 16th of March. Then the government prolonged it till the 9th of April. And now what's in the air is that this lockdown, this shutdown of schools and colleges and other educational institutions might prolong up to the end of Ramadan as well. So we are still not sure, but what I can see is that the government is still trying to take initiatives in order to take online classes. I personally have tested on attending online classes which aren't very efficient, but I don't know what the
Yes.
government is doing. Yeah, even
Yeah.
Shravnee agrees
I
with me.
agree.
Yeah,
I think all of
I
us share a
I
consensus on
agree
that.
with this. Oh my God.
yeah,
because I
But
have to like
and
get up every day at the same time to attend
Yeah.
these online lectures,
And
and if they are not efficient, honestly.
yeah,
yeah,
all my
exactly.
classes
Yeah,
are tedious. Yeah, me too.
We too
yeah.
don't have.
So, in Bhutan, have you attended any online classes though, Thinley?
Yes, the Minister of Education has issued an order that all the students should be taught online. But as far as my concern, I don't know how far it will be effective, because being a country which is mountainous country, where the network issue is first thing. We have a network issue in remote places of our
Mm-hmm.
places. So I think we'll having a tough time with online teaching, but we all the people are giving our best to it. Thank you.
okay,
By the way,
so
can I ask something though? Like, as students, all of us being students, what do you think? Like, how can we actually utilize this? I shouldn't label this as vacation, but it's like not so anticipated vacation. How should we actually be productive in these? Give your opinions if you can.
I share
I have
first.
Okay, so
Okay,
so thank you. So I have a suggestion. Maybe people should gather, maybe like in a cafe or in the study area, and they just study online classes together. Because in my case, where I live in a dorm, when I have to get up at the same time every day to attend online classes, that is kind of not reality. And actually, you can just pause the video and you just can do anything. And I believe that if people maybe study together as a whole, maybe different subjects, but people encourage each other, there will be a very, very efficient way compared to studying alone with the online classes and sessions as well. Yeah. Thank you.
yeah, and I feel like as well that perhaps I won't agree too much with Vivian in the sense that in my country, for example, if we start gathering up and joining classes for being in groups, so that would increase the risk of being uh, tested positive for the coronavirus.
I see, I see. Yeah, yeah, yeah.
But at the
True.
same time, the way I think I've been going about it is that I'm trying to perhaps get to talk to people I didn't talk to usually because of other routine work, to sort of reflect and take a step back and reflect on, since we all get so busy and so taken up by all our routine works, that I think this is a time for us to sort of breathe and look at ourselves as well as the people around us, and
Mm,
also perhaps read a few books or do a couple of things which we've always wanted to do but never have actually gotten the chance to do because of time.
I actually partially agree with Vivian because Ash is like we all are living in our with our own families, right? But she's
yeah.
living in dorm, so maybe limited participation of people could help. Like you can gather 2 or 3 people can gather in the same room, but not more than that, as
Yeah, yeah,
Yeah.
again it would
true.
completely
Mhm.
True,
destroy the
true,
idea
true.
of self
Yeah,
isolation
true.
and quarantine.
True.
Okay, so I think the meeting's about to end as well. So let's just wrap it up here. Thank you so much, everyone, for joining us, for joining me in this conversation. I feel like it's going to be, I feel like it's not only been very beneficial to me, but I hope that it's been beneficial to you people as well. And I'm sure it's also going to be very useful to anyone online who watches this, since I've also been recording this conversation. So, but in the end, I'd just like to say I was hearing an Indian minister speaking the other day. So, in his words, I'd like to say, "Go Corona, go."
It was not actually even Corona; it was Karuna. He even
So
pronounced it
funny.
wrong.